So I want to thank everyone for coming to the first CyberMed Metaverse. So you don't really recognize, but you're in virtual reality right now. And Mark's everyone. We're going to have a good morning, okay? Go ahead and feel free to disperse among the seats as you feel comfortable. We should have some ample seating today. Just to let everyone know, as you're picking seats, we will be having some content on the screen that will require you to look a little bit. So if your vision's not so great, please sit closer up to the screen. And we'll get started after we've ushered everyone in.
All right, we will go ahead and get started. Little AV check here. Can everybody hear me?
Yes.
Perfect. So I'm going to continue to project and hope that we've worked out some of the minor kinks here. Good morning, everyone. Thank you so much for being here. I am so excited to welcome you to this beautiful campus. This is my first time being here on the GW campus, and I'm in awe. I was walking out in front of the hospital. There was a guy playing keyboards, just jamming out right in front of the hospital doors, and that seemed like a great way to go into work. So I'm really happy to be here. Welcome to CyberMed Summit. Welcome to the somewhat unwieldy title, Policy Prescriptions in Pandemic Lessons Learned. And we'll get into that in a little bit. For those who I have not yet had the pleasure of meeting, my name is Jeff Tully. I am an anesthesiologist and a pediatrician who also dabbles in security research. I work with a division of perioperative informatics in the Department of Anesthesiology at UC San Diego.
And my name is Christian DeMeth. I'm an assistant professor of emergency medicine, biomedical informatics, and computer science. I'm also the medical director of cybersecurity for UC San Diego Health. And I just want to say, for the first time, I think, and say, Washington D.C. is hotter now than it is in San Diego.
It's fantastic to see so many friendly and wonderful faces, but there's somebody who should be here with us today who isn't, and so we just wanted to take a moment to share on behalf of Christian and myself and the rest of the CyberMed team our grief and sadness at the passing of Mike Murray. He was an incredible individual, a very early supporter of CyberMed. I was just talking with somebody who said, Mike was a catalyst, and I think that's a perfect word to describe how he facilitated interactions among people, how he encouraged people to new pursuits, how he brought people into the community that we share right now. So our thoughts are with his loved ones and colleagues, and he will be missed, and his influence in our community will be felt for a long time to come. For those of you who are not familiar with who we are, so Christian DeMeth and I founded CyberMed Summit in 2017 along with Bo Woods and Josh Corman. We are a 501c3 nonprofit organization that looks to put on events like this to bring people into, to continue to inspire, and to advocate for healthcare cybersecurity. We have been doing these types of conferences since 2017. We did a great one in UC San Diego in 2019 with the intention of continuing on and on and on, and then unfortunately had a little bit of a 2.5-year hiatus in between. So we just want to say, we understand that for many of us, this is our first event coming back after COVID. Thank you to everybody for all that you have done during these last couple of years, in ways big and small. We really appreciate you. We are so thankful that we can all be here safely today, and it's just great to be back in person, so I'm really excited.
We recognize so many faces in the crowd despite masks, but there are also quite a few faces that we don't recognize. And for that, we wanted to do a very brief introduction. I'm just kind of curious, who here has been to a CyberMed Summit before? Okay, who's this the first time? And then keep your hand up if you feel like you're a real novice in the field of healthcare cybersecurity. You're here to learn, you're here, fantastic. So, we're going to do a brief background. Normally, we could take hours just to talk about what's happened in the last 20 years in healthcare cybersecurity, but we're not going to do that. Instead, what I'm going to do is offer just 3 brief views into some of the biggest things going on in healthcare cybersecurity in the last 20 years or so. Of course, we can't start this conversation off without talking about medical devices. There has been research spanning almost now 15 years talking about the risk of connected medical devices and the vulnerabilities they have, and how researchers from the hacker community as well as the more academic security researcher space have found vulnerabilities in pacemakers, infusion pumps, insulin pumps, and a whole host of other types of medical devices. And so when you talk about healthcare cybersecurity, we often talk about medical devices specifically. It's not just individual devices. There's also a much more of a macro type of attack, where really they're hackers, malicious hackers, attacking critical hospital infrastructure. It's probably best exemplified by talking about ransomware. And it's really amazing how that's changed in the last few years. And if you're interested in this, I really encourage you to start learning more about this, because the dynamics behind ransomware in healthcare really impress upon us how impactful this can be to the delivery of care, patient care. And then what had been the predominant paradigm up until a few years ago was that our privacy is at stake here. We can't go a week without another hospital or healthcare organization, unfortunately, being the victim of a PHI breach, protected health information breach. And so those are the three kind of general areas. There are many others, and there will be many different ones in the future. But to do a brief topic, this is the types of things that we talk about at CyberMed.
And there are lots of other wonderful organizations and events that hit many of these same issues from slightly different angles. What we try to do at CyberMed, how we're a little bit different, is that we really want to bring down a lot of silos, pull everybody involved in the conversation together, and then sort of approach things from a little bit of a unique perspective that is informed by our backgrounds as physicians. So those of you who have seen our presentations before are probably sick to death of this painting, but it is one that made a very powerful impact on us in our first early days of medical school to really kind of conceptualize that physician-patient interaction in its truest sense, right? We are there to care for people at the bedside. And over the last 2 years, the bedside has looked very different than we expected it to, right? We have learned that our healthcare system can be stressed, can be fragile, and needs to be resilient.
It's in trying to learn lessons from that fragility where we seek opportunities to grow. And we've been doing this for some time, and it was clear to us that we wanted to be able to scale the things that we were talking about. These are really difficult problems. And so, moving forward, we thought a policy-focused event in our nation's capital in collaboration with GW would be a perfect way to spark this conversation about how we can make change really on a macro level.
Because, unfortunately, even as we are in the grips of a pandemic, dealing with surges and stresses on our infrastructure like never before, we are also getting attacked more frequently than ever before. And we have a number of unfortunate situations where we have learned that delaying and degrading our ability to take care of patients while we're already stressed can lead to some unfortunate consequences.
It warmed my heart to see so many people who this was their first CyberMed. And what we wanted to do in this opening talk is not only introduce why we chose a more policy-focused event for our first one back, but also to welcome into the fold the needed specialization, your expertise, your voice, who you are as a person, to bring that to the conversation, whether you be a policymaker, law enforcement, manufacturer, researcher, clinician, an HDO, or even a patient, because we're all going to be patients one day. Your voice is important in this, and we welcome you to CyberMed, where your voice can be heard, and we encourage you all to do that, because we're going to need you to solve some of these really big problems.
So today we're talking about challenges, but we're also here to celebrate some pretty notable accomplishments. And if you are following this space, you understand that we have a renaissance of policymakers and regulators who are interested and passionate about this topic. We have exciting new legislation, some of which has passed, some of which is still currently in discussion. But the cool thing about today is that we've assembled many of the people responsible for some of these incredible accomplishments here to talk about how they did what they did, what still needs to be done, and how we can work together to start tackling some of these problems in a more focused way. So just a couple of housekeeping reminders here before we get started. There is an indoor mask mandate at all of our indoor facilities for today. If you are not eating, drinking, and or speaking, we ask that you do keep that mask on. There is no food here. I see people are being really great about that, so thank you very much. No food in the auditorium, although we will have a lunch that is catered at noon. Our media policy and our safety policy and code of conduct have been available for you and have been reviewed by you prior to coming here. If for any reason you need to reach out to us and make a safety report, please feel free to use safety@cybermedsummit.org or that number there to make a report. That line will be monitored 24/7 throughout today's events. And so we have a lot of people to thank, which we will do later today, but first and foremost, we just have to appreciate the incredible collaboration that we have had with GW in getting this event off the ground. I'm sorry I have to do it. Lance Hoffman up there in the front has been a primary driver and mentor for this project. I'm so glad to see him here today. And if you are involved in cybersecurity in any way, shape, or form, you probably owe a debt to him, as he's one of the fathers of the specialty. So very exciting and thankful. But a number of other components of GW have been wonderful and welcoming. And so